Hi, my name is Tim. I'm a medical student from the University of Alberta. Today I'm going to be showing you some surgical aseptic techniques, including scrubbing, gowning, and gloving. So before we get started on scrubbing, it's very important to get set up properly. So one thing you want to always make sure you do is just clean your fingernails for that day. Okay? And you just want to scrape along it on both hands. The other thing you want to make sure you do before you get started is put on any masks or eye protection. There are two main types of scrubbing in. There's dry, which involves this EVA-Guard. And what happens is you just squeeze a pump into your hand like this, rub your fingernails in, and just fork up one arm to your elbows in circles. Do the same with your other hand. Make sure you dig it in between your fingernails. Just fork up into your elbows in circles. Finally, just get a good amount in your hands. And make sure you get all your fingers and all the cracks and fingernails too. There's also wet scrubbing, which involves soap and water. So you just open one of these packets. There's something for your nails. And you want to wet your hands first. And make sure you scrub all your fingernails with a brush, the back of your hands. And like the dry scrub, just take a sponge and work your way up in concentric circles on each hand. Make sure to keep your hands up and away from anything that can contaminate it. After you're done soaping up your hands, you need to wash the soap off. So starting from your fingertips, you want the water to run from your fingertips to your elbows. Just turn on the water. Okay, and you turn off the water, and you want to make sure you keep your hands up and elevated. You want to enter the OR with your back so that your hands aren't touching anything. And at this time, the nurse will help you put on your gown. Just throw it on you. Just go and stick your fingers out, and someone will tie it back behind you. And just cut it. So the nurse will put the glove out like this, and you just put your hand down. And it's okay if you don't get all your fingers in, because you'll fix it. Stick your right hand out, put your glove in. And once you have both hands in, you can fix up your sleeves. At this point, there's a tie down here, just pull it apart and hand off the right side to the nurse and just spin in a counterclockwise fashion. At this point, you just tie it up. And just keep your hands either holding your shirt or right in front of you. Never below your waist or above your collarbone area. So sometimes you have to set up your own, you have to glove yourself. So just get everything set up. And so normally, just don't touch any of the unfolded parts. So you would have gotten your gown on at this point. And so just take the glove, using just your gown, and place it where your fingers are facing you. And just hook it underneath. Get one hand in. At this point, with your other hand, you can touch the outside of your glove. And similarly, just put it on and just cup. Flip it over. And after you have both your gloves on, you can adjust your sleeves and make sure all your fingers fit. And that's aseptic technique for surgical rotation.